We see judgment from well-meaning family members, from friends who expect us to make similar choices, whether it's in how we feed our baby, how we parent, or where or how we give birth.
Everybody, I'd like to welcome you to my podcast Renew Motherhood. My name is Blanka Falk, I'm the host, and for this episode, can motherhood truly be judgment-free? I've got an incredible guest here, Kristin Revere. Please briefly introduce yourself. Who are you? Where are you from? What does this topic make to you?
Thanks, Blanka. So, as you mentioned, my name is Kristin Revere, and I am a birth and postpartum doula. I own Gold Coast Doulas in Grand Rapids, Michigan, and we serve families from conception through the first year with everything from classes to birth doulas, postpartum doulas, sleep consultants, you name it, lactation. We provide it as long as it's non-medical. And my passion has always been to support women. Feel like that is my purpose. I used to be a political fundraiser, and my goal was to get women to feel confident, not only to run for office, but to certainly raise enough money to win their races. And so, yes, and I've always tried to mentor young women in the professional sector, even starting, I mentor at an area college honors program, and I became passionate about women's health and this time of transition after having my own kids. So I did not become a doula until I had my second child, my son.
Wow, that's great. So I hear this a lot, that women change if they get their first babies, if they get their first children, and the whole perception sometimes changes, right? Because you can see your life from another angle and get some more passions or some more, I don't know, life curiosity or whatever it is sometimes. And I think this is just wonderful, because motherhood is so wonderful if you can embrace it. But I know that there is a lot of pressure on it, and there are so many mothers struggling with it. And this is what the podcast is for, to inspire and encourage. And I like to just jump into our topic. So you are a doula, and when I just heard this the first time when I got my first baby around, okay, you can have a doula, I didn't know what it is. What does a doula do? And what does support for mothers as a doula look like?
Great questions, Blanka. So there are many types of doulas. Birth doulas support families wherever they choose to have their babies. So it could be hospital, birth center, home, in three primary ways. And at Gold Coast, we pride ourselves on judgment-free support. So we fit in well with your topics of, motherhood and so on. So some doulas do have a niche, and they might only support home births or unmedicated births or hospital, for example. But at Gold Coast, we support every type of choice, not only in birth, but in parenting. Other than we do not support unassisted births. There has to be a provider there, like a midwife at home, or obviously in the hospital, there's always a physician or a midwife.
Yeah, yes.
And then,
what's the difference between a midwife and a doula?
Great question. So doulas are there more for the mental health and physical support of our clients. So we are a coach in many ways, and we can be a hand holder, support the partner just as much, where a midwife or an OB-GYN would be there to monitor the health of the mother and baby, or sometimes there are multiple babies. So we are non-medical support, and so we do a lot of physical techniques, from labor massage to counter pressured hip squeezes, getting our clients in different positions in labor and supporting them those ways, and also giving them information if it's not an emergent situation, so they feel like they can make informed choices and ask good questions.
Would you say that it would be important to be informed before you're having your baby, or would you say this doesn't matter, you can still make your choices if you have just given birth? What's your opinion about this?
My opinion, and I am a planner by nature, and as doulas, we like our clients to be informed, but it is up to your personality and your time. Some people wing it in life, and their goal is to be a patient and trust their provider and hand select their provider. And others want to understand what their body's doing in labor. I am a big believer in not only hiring doulas for support, but taking some time and educating yourself. And so that could be taking a comprehensive childbirth class like hypnobirthing, that's very partner focused, mind body centered, great for anything from an unmedicated birth to a surgical birth, or a class like Lamaze or gentle birth or Bradley method. Something that gives you the information about potential interventions, understanding your body, understanding different pain relief techniques, no matter what choices you make in your birth. And so in having that partner or other support person attend the classes with you. So there are times in labor, especially if you don't have a doula, where you may not be able to advocate for yourself. So if your partner's taking classes, or watched, birth stories or documentaries or read books with you like the birth partner, then you're able to be more informed and feel like birth isn't just happening to you, no matter the outcome.
Oh, this sounds good. Yes, but I just thought, let's talk about the judgment here, because sometimes I think we have got a special box for motherhood or something like this. So what's the most common judgment mothers don't even realize that they have internalized?
So certainly we see judgment from well-meaning family members, from friends, who expect us to make similar choices, whether it's in how we feed our baby, how we parent, or where or how we give birth. And so we find society and the media certainly also includes some judgment. So we're all unique individuals. Our experience, our medical history is very different. So it's not something that is textbook and you can just follow this particular formula. We are unique individuals, and our parenting goals are often different from those of our friends or family members.
So true, because I can totally relate to this. I've gone through this with my first baby. I gave birth at home and I was so judged from the family. What have you done? Why have you done this? Why didn't you go into the hospital? What's going on with you? Are you crazy? And all those things. And instead of supporting me, because I've done it, it was our decision with my partner. We said, okay, we stay at home. So it was in the last moment actually, but we decided to not go and get our child on the way to the hospital. So we said, okay, let's stay at home. But instead of supporting, I just felt they just turned around and said, okay, you have done this choice, we don't support you anymore. So what's going on here? This was really crazy, but on the other hand side, I can somehow, I can understand what they are thinking, because they're coming from another age and from another, they are not familiar with new ways or new perspectives. It has always been this way. Why are you changing now? Something like this. And this is, I think, I would wish that every mother has got her choice to go this way that feels just aligned with her and not with what others expect, right?
Right, absolutely. That's what it's all about.
That's what it's all, Is there such a thing as a wrong way to do motherhood? Would you say this?
I don't think there's a wrong way to do motherhood. So it's all about trusting your instincts, understanding your own body, and no one knows your baby or babies the way that you do. Now, certainly there are some ways that could be considered unsafe if you're not keeping up to date with all the product and baby gear recalls that are happening, and understanding the safe sleep techniques, for example, car seat safety. So I don't feel there's a wrong way to parent, but that it is important to keep up, especially for your baby's safety, on everything from product recalls to safe sleep. Because what our parents know as safe sleep is much different than safe sleep now, where you can't have stuffed animals or bumpers. Sleep? Babies should be on their back, where babies used to be on their stomach in the past. And there used to be crib bumpers and stuffed animals and all of the things that can cause suffocation. And so it's important to understand modern safe sleep, and feeding has changed. And again, everything from car seat safety has changed from you know, how our parents raised us. It's quite different.
Yeah, that's so true. Yeah, so we can't always take everything from the past into the future, right? Sometimes we have to make some adjustments just because science is developing, we are developing, and we have to implement some new things, right?
Right.
To move on. So what's one thing you wish every mom knew before they start taking advice from others?
So find evidence-based resources, know how to filter information. I feel like there's so many mom groups on Facebook and other platforms, let's say like a baby center, where if you're seeking information and asking questions from other moms, the advice they give might be outdated or may not be beneficial for your particular situation. Find expert, trusted resources like Evidence-Based Birth or ACOG to find information on medications you can take while breastfeeding, for example. Don't ask that in a mom's group. Talk to your provider or look at a site like Kelly Mom that offers the correct information.
Yes. So I know about opinions. Everyone has got an opinion about mothers and children, and but they are sometimes just in the contrast, they're contrary. So whom do you follow, right? Is this the left one, the right one, the middle one? And what I always like to say is trust your gut feeling in this too, because some advices may seem very clear or very instructive or very good, but if you can't align with it, if you can't feel it, sometimes I think might not be your way. Might good for others, but as you just said, as you just mentioned, we are all individuals, so we have to find our way in this too, right?
Absolutely. Trusting your gut is what it's all about. Understanding how to sift through the information and make informed decisions, but when it comes down to it, trusting the instincts we're given as mothers, whether it's baby 1 or baby 4.
Yes. Do you have any advice how to step into your intuition?
So certainly, understanding that you have this internal wisdom we all do pass down from generation to generation on how to, care for your baby. Now, we may have struggles with breastfeeding where we need to seek a board-certified lactation consultant, an IBCLC. But if we are thinking that, something is off, like I had pain in breastfeeding and a tongue tie wasn't caught right away in the hospital. And this was with my second child, and it felt off compared to my first experience. So I found out that my son had a tongue tie, got it revised, and then breastfeeding felt so much better. So we don't have to suffer in pain If you're experiencing discomfort in the postpartum recovery time, say something. I mean, women will suffer in silence and will have severe complications or have passed away in that postnatal time because they tolerated headaches or swelling or bleeding that was beyond normal and didn't go back into the hospital because all they were focused on is their baby. So I think trusting our instincts, not only as mothers to our baby or babies, but also in understanding our own bodies and what feels off to us, even if providers are saying that we're okay.
Would you say that your partner has got a crucial part in this too? Because I just can remember that my pain level just increased with having the first baby, and I was always thinking, that's okay, I can deal with it, until it got to a point when also my late husband just told me, have a look at yourself, please.
Right.
So sometimes we are just familiar, or not familiar, but just giving birth to a child, we think it's okay to have this pain. It's crazy, I think, but it's not, right?
Right. Our partners also know us in such an intimate way. And the mental health aspect of it, especially in that postnatal phase, our partners, if they're educated on, say, the difference between baby blues and those hormonal fluctuations and perinatal mood disorders, postpartum depression or anxiety or obsessive compulsive disorder, the different signs that show up, and if a partner can advocate and point out to us that we should seek help or talk to our provider or look at a support group. So again, things can certainly worsen with lack of sleep. And so the more sleep deprived you are, the increased chances of having perinatal mood disorders. And so our partners can help with that and do a diaper change after a feeding or take a shift. Or you can certainly hire a professional like an overnight postpartum doula or a newborn care specialist to be able to support the entire family's sleep. No matter how you choose to feed your baby, there's a benefit in having a doula overnight.
That's great. I love this advice. Say this again, please.
Yes. We don't have to suffer. We aren't meant to do this alone. And so ask for support and, know when things feel off and get help.
Yeah, this is so beautiful because I don't hear this very often, to say, hey, you don't have to do this alone. We are here, we can support you. And I think this is so crucial, and it's so wonderful to really have some specialists who are here to help. And I think this is, yes, that's the beauty of it. So you say judgment-free support, but how do you actually create a kind of space for a mom?
So hearing them out, figuring out what their goals are. And as postpartum doulas, it can be different every day. One particular day, a client, if we're supporting during the day, for example, a client's goal might be to take a nap and a shower and have a cup of tea out on their porch and feel like their self before having this child. And other times, there may be a checklist of things to do around the house, like some meal prep or running the vacuum, things we're not supposed to be doing after delivering. And it could be accompanying our client to a pediatrician appointment to help them ask questions and carry the baby and all of the things that might feel a little scary. I've gone with my clients on their first grocery shopping trip with baby because they're worried about a blowout, or if they need to change baby and need to stop for a feeding and how to navigate that. So it can be so different, and every parent has different goals. We've had clients hire us that just want someone there to talk to during the day, to run things by, to, you know, have in case they have questions and anything from, you know, wearing their baby with different baby carriers to this particular swaddle they want to try out, to setting up the nursery to be optimal for sleep. And so every client's a bit different and every day can be different as far as goals.
This is so wonderful, and I'm just thinking about my first baby, having my first baby, and the moments when taking a shower is a task, is a challenge.
Will baby wake up and cry, and how will you navigate that if no one's in the home? So you need to wait till your partner's home. And then the loneliness. My husband had to go back, you know, after we got back from the hospital with my first to work. So he had no paternity leave. And I was alone with my daughter all day. And I was used to, you know, being a career professional and having colleagues around me all the time and being busy. And here I am with this baby, and I was lonely. So my husband would get home and I would just want to talk to him or have him hold the baby, and he's trying to decompress. So if I would have had a postpartum doula there, it would have made a world of difference.
Yes, so true. Sometimes those little things that we now can think about, it's normal, it's nothing special, but in these situations of the this transformative process to become a mother, these things aren't not normal anymore.
Right.
Sometimes you think, wow, that's crazy. What's happening inside of our brains? But it's all this new way of living, right? Stepping into motherhood is a big thing. And sometimes I think we just have to talk about this more. Sometimes I think, in this moment, I always thought I'm the only person who's not able to do this. But that's not true. Yeah. Just because we don't talk about this doesn't mean it's existing. It's there, right? So have you ever supported a mother who made a totally different choice that you would? And how did you handle it?
All of the time. Again, with the focus at Gold Coast Doulas on supporting without a judgment. No matter how you choose to birth your baby, how you choose to feed your baby. So I was very focused on breastfeeding and having success there. I have had clients, birth doula clients, that their goal was to formula feed from the start, and I supported that. Now, some birth workers in the space, whether it's a midwife or a doula, may have their personal opinions factor in and are not truly leading without, judgment. And so if they believe breast is best, they might then advocate, but we step back. And as long as things are not unsafe, so if everything is safe and they're following, the formula instructions, as written, and we will support whatever the client chooses. And so I helped my client advocate in a hospital that is focused, it's a baby-friendly hospital, on that attachment, the first feeding. And so we put a sign above her bed to let the nurses and doctors coming in and out know that she was not going to be breastfeeding and to not ask her to latch her baby. So it is not my birth or parenting journey. I am there to support my clients in their choices.
Wow, that's big, I think. So, and actually to step into a neutral place and to say it's her choice and I can only do what's best for her, and not to convince from anything else. She had made this choice for whatever reason she knows, but then to still stay there and support her in the way that she needs it. This is great. I love this.
Absolutely.
So that's wonderful.
And I know my own doulas had some, particular beliefs that they tried to, get me as a second time mom to align with their ideals. And so later on, when starting Gold Coast, I really wanted to be as neutral as possible and not have any influence on my clients' decision making.
Yes. Would you say that there is a way to say before they make their choices, to say, okay, giving them all the information so that they can have their best choice? Would you say this helps?
Absolutely. So I wrote a book, I co-authored a book called Supported Your Guide to Birth and Baby. And it gives a very neutral slant. I feel like a lot of books on the market are geared to a particular way of feeding or parenting or birthing your baby. And so this is sort of a choose your own adventure and gives evidence on all of the choices you make. Newborn procedures. I have a pediatrician who contributed to that chapter, and a mental health therapist on perinatal mood disorders, and a board-certified lactation consultant, and IBCLC wrote about not only breastfeeding, but all types of feeding, including pumping and formula feeding. And so I wanted a book that everyone, whether it's a new parent or a seasoned parent, a home birther, hospital birther, or someone who plans to be an attachment parent, or someone who is more structured, could relate to. And so there aren't a lot of options. I feel like even some of the, birth videos might be slanted toward just the unmedicated birthers, for example. If you're taking a childbirth class and your goal is to get an epidural right away, what examples do you have in a class that you're taking?
Yes, there are probably sometimes not so many examples, or they're going in one direction.
Exactly.
So, and if you think about another way, you might feel alone if there is nothing that you can look at. That's beautiful. I think to come from a neutral place and to give all the information. Okay, here is your buffet, just to pick what you like, what's aligned with you and what suits to your life and your way of living, and take this, and you're not alone with it. I think this is nice. I like this. Do you think the pressure to be a good mom is actually hurting mothers?
Absolutely. I mean, everything from Instagram and these perfectly filtered lives, but I do love the realness on social media and YouTube channels and Instagram of maybe the messy house and people being vulnerable. We are in a time of vulnerability. And so I am thankful for some of that. But looking at the filtered versions, the highlight reel of other moms, especially mom influencers' lives, can make us feel less than, or that we don't have our act together and everybody else seems to. Or again, those Pinterest boards with the perfect nursery and all of, the cute parenting moments and the meals moms are making. There's nothing wrong with hiring help, whether it's a housekeeper, a postpartum doula, a nanny, an au pair, whatever it might be. But again, I can't say it enough. We aren't meant to do this alone, and the filtered versions are not reality. I bet they have help, or they're only showing the highlight reels.
Yes, so true. I believe this too, that there must be some help. You can't, I think it's not doable to do everything, to have everything in the right position and to be so structured, organized, and your baby is lucky and happy and
sleeps,
so
8 hours
you get
a night,
enough
naps
sleep,
perfectly.
you get enough from everything. This is not, that's not true. That's really not true. So would you say that what would you say to a mom who feels like she's constantly being judged, even by herself? What would you suggest to her? Because sometimes the judgment doesn't come from the outside, it comes from the inside too.
Absolutely. We can be our biggest critics. more so than friends and family or other mom group members. And so really stepping back and owning our experience and, just being in the moment and enjoying what we can of this journey, because it goes by so quickly. So bond with your baby. Who cares about the messy living room? Focus on resting and recovering from your birth, no matter if it's a surgical birth or a vaginal birth. You still need that time. And if people are coming over to bring you a meal or to visit baby, you don't have to be the perfect hostess. You can tell them that you need time to nap. It's a unique journey, but I find that my postpartum clients especially have to set some boundaries with visitors and really structure their days so they're able to get rest and feed and not feel like they're entertaining, because after we give birth, it's all about the baby. And mothers are celebrated during pregnancy. We have baby showers and people are asking how you're feeling. But once you deliver, it's often, let me hold the baby. How's the baby? They're bringing gifts for the baby. And women often feel alone and isolated and judged. So understand that you are doing everything you can to be a good mother. And there is no formula, because we're all different.
Yes. So place your thoughts on yourself to recover and to feel yourself again, right?
Yes.
Not only to be present for the baby, but also to be present for yourself. To say, okay, how does my body feel? What makes me happy now? Really? To step into, and if you can't get, or if you have got wishes, just say that what you wish and seek for help. That's it. That's always again.
Yes, you've got it.
So what's one parenting rule you wish we could throw out forever?
Don't know if it's necessarily a rule, but certainly there are a lot of norms in parenting. And the biggest thing is, again, just feeling like we need to be super mom and not ask for support from our partners or our, other family members. And so the norm of just feeling like we don't matter and it's all about the baby is something that I would like to do away with, because we matter as well as moms. And if we're not doing well, the baby's not going to thrive. And the other children, if there are other children, are not going to as well. So put that oxygen mask on yourself first, and don't feel like you need to be a martyr as a mom.
Yes, that's wonderful. I like this. So if a mom only remembers one thing from this episode, what should it be about judgment and self-worth? Would you say this was the last sentence? Put your oxygen mask first.
Absolutely.
Or is there anything you like to add?
Trust your instincts. Again, not only on caring for your baby or what may be going wrong for your baby and speak up, but also your own body. We know our bodies, we know when something's off, and it's so important to say something. The rates of maternal mortality should not be as high as they are. And, infants are still dying of SIDS, and the infant mortality rate is higher than it should be. So we need to advocate not only for ourselves, but also for our babies.
Yeah, absolutely. I love this. What do you offer other mothers? What can they get from you, and where or how can they get in touch with you? So you're a doula, you wrote a book, but I know you've got a lot of...
Yes, certainly. Thanks, Blanka. So my website is Gold Coast Doulas, and you can find a lot of virtual services on there if you're not located in Michigan. So we offer classes like modern grandparents to get grandparents up to date on some of the safety and feeding changes that we discussed.
Beautiful.
And we have a Preparing for Multiples class that again is private. Both options are private, customized on your unique needs, so no template. And we offer virtual hypnobirthing classes, a breastfeeding class, newborn survival class, tired as a mother class in 3 different age stages. And so lots of options. I've got an online birth and baby prep course called Becoming a Mother. And that's thebecomingcourse.com, but also found at Gold Coast Doula. That is great for new and seasoned moms and allows you to, again, look into different experts that you want to get more research on. So cord blood banking versus donation. I have expert videos in the course, and pelvic floor physical therapists, all of the birth and baby dream team members. We've got 30 videos besides the 6-module content within the course and workbook. And then I've got the book that I mentioned earlier, Supported Your Guide to Birth and Baby. That is great for no matter what your birth and parenting and feeding choices are. An easy read. And that is available in ebook, so Kindle, paperback, hardcover, and we have an audiobook version.
Oh, that's great.
Yeah, so it can be found at all the online booksellers and then select bookstores and libraries. But yeah, and so we recorded the book ourselves, so that was quite the journey. But I loved the process and making it more accessible and affordable for moms to get judgment-free information.
Wonderful. Thank you so much for coming on my podcast, for getting to know you, your topic, and your offers and your help, actually your support for mothers. I think this is what we need and what mothers need, and to get inspired, to get encouraged, and to really to ask for help. This is so crucial. Thank you so much, Kristin, for coming on my show. And yes, all the listeners, please subscribe, share this with your friends and family if you like this episode, and let's encourage and inspire more mothers.
Absolutely. Thanks, Blanka. And mindset is everything. I love the work you're doing.
Thank you.